Well, hello and welcome to another one of our Association of PEMF Professionals Thursday Live. I'm Dr. Jerry Dreessen. I am the Executive Director here at PEMF Professionals, national organization. And today we're going to do a little deep dive into some of the research that we've got going on. And that particularly is this. There we go. We're going to be doing in our Ask Dr. Jerry program. Today, what I want to do is talk about Shoulder Impingement Syndrome, or SIS. And this is one of the articles that you can find on our website in our research article section where you learn a little bit about that. But I thought, pretty much I think 90% of us over the age of 40 has got some kind of shoulder problem from the stuff that we do every day. And wouldn't it be nice if we could talk a little bit about what's going on with impingement syndrome, how PEMF works on that, but then also how PEMF is making a presentation on how well it works in the research field. And these are little tidbits of information that you can take with you when you are presenting yourself and your services to healthcare professionals, PEMF and shoulders, because I can't think of a healthcare professional that hasn't looked at somebody's shoulder. And if you could come in as a practitioner and with our certification program and say, hey, let me work on your clients with shoulders, give me your worst shoulder, give me your athletic shoulder, those kinds of things. It might be pretty good in for you to do that. So let's jump in and talk about this. And the article is Pulsed Electromagnetic Field and Exercise in Patients with Shoulder Impingement Syndrome, a randomized, double-blind, placebo-controlled clinical trial. And these are the ones that I really like because the people getting the application of PEMF have no idea whether it's PEMF or not. In their mind, it either is or isn't. And it's double-blind, which means that the person putting the device on the person, neither one of them know if what they've got is the real thing or not. So that's what the double-blind placebo-controlled trial means, which is what makes this a really good article. Shoulder impingement syndrome. What the heck is that? Let me move out of the way here. So shoulder pain caused by connective tissue, like a tendon rubbing on a shoulder blade. Impingement syndrome is caused by inflammation from the repetitive shoulder activities. Injury and aging are other causes, and pain may be consistent and increase with lifting or reaching movements. We see a lot of this in our young weightlifters because they haven't quite figured out the proper techniques. They just go to the gym, seeing somebody else doing shoulder stuff. They do it, so they'll get flared up. There's also the problems with slips, trips, and falls, people landing on the ground, hard, soft surfaces, and hurting themselves. Older people doing sports, throwing the ball, catching the ball, basketball, all of those things. Again, fast, ballistic things. Usually what happens, if you really want to go into the history of injury, is the older we get, the more our tendons become hardened. And one of the ways we soften tendons is with vitamin C. For an example, cats synthesize their own vitamin C, and that's what makes their ligaments springy and gives them their jump that they can do even when they're 17, 18, 19 years old. They still got spring in their step. We as humans, we don't, and we have to consume vitamin C to keep that. And if you're not a vitamin C eater, then chances are your ligaments are getting hard, maybe even brittle, and you've got injury. Well, they also attach to muscles, if they're tendons, and now they're yanking on that tendon ligament connection like you see in this image here. and starts to rip and tear stuff. Perfect setup for PEMF as far as what it does. Goes in, repairs tissue, repairs the cells, the organisms that are part of, or the organelles that are part of the system. And those of you that have already have your certification know in our teaching that we go through pretty extensively how all of that happens, and using PEMF and the proper protocols to do that. What I did today is I included a video on another doctor doing the actual tests for 3 of them to help prove that there's a shoulder problem. And these are the things that you can do before and after your treatments or sessions.
Okay, so let's go ahead and see how these tests are performed. The first test is going to be the pate test. So what we're going to do is mirror this arm in the plane of the scapula with the elbow in 90 degrees of flexion. The examiner is going to support the elbow with one hand, and the other one is going to evaluate the strength and pain and external rotation. So you want to resist me. And it will be positive if there is pain. With the NIRS test, the examiner is going to prevent scapular rotation with one hand, and while the other one is passively elevating the arm into flexion. And that's going to be positive if pain occurs. So let's go ahead and turn you just a little bit, Meredith. The Hawkins-Kennedy, the examiner is going to face the patient and flex the arm to 90 degrees of flexion, and the elbow is going to be at 90 degrees of flexion also. Then the examiner is going to go ahead and passively internally rotate and adduct the arm, and that's going to be positive if pain occurs.
So, as you can see, there are lots of exams, and you can do shoulder impingement syndrome exam and learn all the different ones that are out there. But one of the things that these tests do is it helps you locate the source of the pain, and that's oftentimes where the tear is. There might be multiple areas where there's tears, and there are the rotator cuff muscles and their attachments to the bone, which is the arm. There's also one that attaches off pec minor onto the shoulder blade that's inside between the arm and the chest wall. So there's all these different areas, but it gives you an idea of where the pain is, and then your pre and post testing after a session. And so this helps us determine what's happening. So let's go in a little bit more here with the research article. So the objective of the article was to evaluate the effects of pulsed electromagnetic field therapy and exercises in reducing the pain and improving function and muscle strength in patients with shoulder impingement syndrome. The design of the test was a double-blind randomized controlled trial with a 3-month post-treatment follow-up. The setting was in an outpatient rehabilitation of a public hospital. And then the patients were between the ages of 40 and 60 years of age with a diagnosis of shoulder impingement syndrome, and they were randomly assigned to receive either the PEMF or a placebo. The interventions were after 3 weeks of active or placebo PEMF. Both groups performed the same program of exercises that focused on shoulder strengthening. The main outcome measures were a visual analog scale where they would, like a 0 to 10 scale, rate their pain. The University of California, Los Angeles shoulder rating scale, and you can go research that and pull that up. And then the constant Murley shoulder score, another one, and then a handheld dynamometry for muscle strength. So instead of a person holding them and resisting them like we saw in the video, this is a device that measures degrees of motion. And then at 3 weeks, and then at 9 weeks, and then at 3 months post-treatment. The results are the patients in the active PEMF group had a higher level of function and less pain at follow-up timeframes compared to the baseline. So there was a noticeable difference. However, the placebo PEMF group had increased function and reduced pain only at the 9-week, 3-month follow-up, which is after performing the exercises. So that whole time they weren't getting any kind of relief until they started moving the joints, which is basically physical therapy, but a joint will heal when it starts to move. And then as far as measuring things, the active PEMF group had increased strength for lateral rotation and increased strength for medial rotation when compared to the baseline. So the bottom line here is there was no significant difference for the shoulder strength in the placebo group on all outcome measures. So this is again, it's great. The conclusion was, the combination of PEMF and shoulder exercises is effective for improving function and muscle strength and decreasing pain in patients with the shoulder impingement syndrome. The awesome thing about that, and again, if you take this to any healthcare professionals, they're going to want to know if it's double blind and was placebo. And that's what's really cool about this one. Now, you can find this article that I'm doing the video on today if you go to our website, and it is in the PEMF course for humans. Is part of where you will learn how to do these things. But the research study itself, and I apologize, it didn't pull those other ones down. But if you go into our research system, you'll be able to find those. Again, if you become a member, if you're not already, you can go right into the course details and find out what it's all about. We have the course outline with the certification on human side, lays out what it is that we talk about and what we teach. Again, there are multiple certifications. You can get just general PEMF as far as learning what this is all about, and then you can become certified in either small animal, large animal, or human. And when you do get your certification, you can choose. I don't know if I laid it in here. Must be on this bottom one. Yeah. So if you join today with your membership, you can pick 2 of the certifications of this group. A lot of people, if they're doing humans, they'll do like a general and a human. Some people do general and a small, general and a large, or just small and large to get going on those courses. So it's a great program to do. Again, we take your when you join, that money goes towards us putting the courses together. Also, your lobbying for you with the things that we've been talking about, in our previous courses as well. In fact, if you go to last week's live, you'll see Lauren and I talking a little bit about the things that we're doing behind the scenes to help our PEMF organization out here in the United States, but also nationally. There are some things that we're doing too. Which is why I would recommend joining us. If you are seeing this for the first time, wondering who we are, what we're about, the Association of PEMF Professionals is all about anyone who has a PEMF device, whether you're doing it professionally or on your own. If you're doing it as a business, if you're a healthcare professional and you're looking at bringing one into your practice, we're the organization. We've been doing this now for 10 years. Organization has been slowly building when we first started out, but we're in 17 countries, and we've got a lot of great history, a lot of great things that we're doing too. And that is our goal is to do a live every Thursday where we talk about a subject. And I want to thank you for jumping in and watching our shoulder impingement syndrome. There wasn't a lot that I presented. It's inside the course, and I go into great detail on working with the different types of treatment, whether it's passive, whether it is without weight, without resistance. We do a lot of I don't know if it's groundbreaking techniques and treatments that we do, but that's definitely one of the reasons why you'd want to become a member. And of course, we have our Insider membership. You get our newsletter. If you're not a member, we have our PEMF Con coming up in October. It's a great way to kind of do a deep dive into what we're all about. If you're a member, you get to be part of that at a discount, which is really cool. One of the things, it'll be our second one. So we're really looking forward to presenting this, and each year it's going to get better and better. So we've got some really good speakers. Again, still waiting for our last one to confirm, and then we can present who our speakers are going to be, which is going to be awesome. What you can do as far as here at the Association of PEMF Professionals, you can like and share this video. It goes live on Facebook and YouTube and LinkedIn. So if you're a member over there, if you can like and share it at that point, that would be great. We have our blog online where you can read articles, and of course the research articles like the one we talked about today. And then we have a members only on Facebook where we jump in and answer questions through the association. Of course, we have our other Facebook page as well for those of you that aren't members and have just general questions. You can be a part of that too. On our website is our code of ethics. So if you are seeing this for the first time, wondering who we are, this is it in a nutshell. We're here to help you out. We're here to do best practices, take out all the fluff and give you all the facts so that you can present PEMF the way it's designed to be, which is a tool for healing animals and humans from the cellular structure and the techniques that are used to do that. So again, thank you very much. If you want to become a member, just head on over to our website, pemfprofessionals.com. Questions or tips, if you see things that you want to know more about or want to see more on our videos that we do on our Thursday Live, drop us a link. We'll be more than happy to take a look at that, maybe make it be alive as well. So again, thank you so much for your time today, and I look forward to seeing you next week on the next Thursday Live. All right, take care and have a great day. Thank you very much.